Uh, Good afternoon. It's my great pleasure today to welcome Premier Ford, Minister Elliott, Bay of Quinte MPP Todd Smith, and our local partners, including Mayor Ferguson. Particularly welcome them to the Quinte Healthcare Prince Edward County Memorial Site, located in Picton in southeastern Ontario. My name is David McKinnon, and I live in Prince Edward County and serve as the chair of the Quinte Healthcare Board of Directors. Prince Edward County Memorial is one of 4 Quinte Healthcare hospitals that work as one system of care serving our entire region. This rural hospital has served the people of Prince Edward County and some surrounding communities for more than 100 years. It was started up mainly by women and opened its doors in 1919. That long history is central to our sense of community. Technology and circumstances may have changed over the past century. They've changed many times, but the passion this community has and feels, and passion is the right word for this hospital, has not. The pandemic has been an earthquake for the hospitals, and I want to acknowledge the efforts of all staff, including those in the back offices and physicians, in dealing with the problems resulting from the pandemic, including, especially, managing the increased stress experienced by all. They have faced these problems with conviction, ingenuity, and adaptability. Our community, like others across the province, has really stepped up to show their appreciation to our healthcare team. They've been sewing masks, they've been donating funds, they've been offering food and other necessities. Our partners have been ready and willing to work with us in this constantly changing and very challenging environment. I would like to recognize 2 groups of people. First, the people in the Ministry of Health and elsewhere in the government who have helped us manage great challenges in recent months. The guidance coming from the province has been most timely and helpful. I also wish to specifically acknowledge political leaders at this time, including our guests today. I want to acknowledge the resolution that it takes to be a political leader during unprecedented times. We haven't seen times like these in 100 years. And political leadership is especially important. It's always important, but it's especially important in times of crisis and not always for the faint of heart. So thank you to each of you. We really, really appreciate the work you're doing. And we know that that resolution will continue to be vital as we look ahead to the future needs of our communities, both urban and rural, and to further work getting this pandemic under control. And with those introductory comments, it is my honor today to introduce Ontario Premier Doug Ford. Premier.
Well, thank you so much, David, and the entire team at Quinte Health for the warm welcome today. I'm excited to be here in beautiful Picton in Ontario. And folks, I have to tell you, when we get through this pandemic, you have to visit Prince Edward County and Picton. It's one of the most beautiful towns anywhere in Ontario and some of the greatest people in Ontario as well. With our tireless Deputy Premier and Minister of Health, Elliott, and our local champion, and he's a true champion, Minister of Children and Community Social Services, Todd Smith. I'd also like to recognize Prince Edward County Mayor Steve Ferguson. Mayor, you're doing a great job. Absolutely fantastic for your community, and thank you for your true leadership. Our government will continue to deliver results for the people of Prince Edward County. It's why we've provided over $1.7 million through the federal Safe Restart Agreement to support municipal services in transit in Prince Edward County. We're adding 76 new long-term care beds and are upgrading 84 existing beds at the H.J. McFarland Memorial Home in Picton. These new and upgraded beds will ensure our long-term care residents have a comfortable place to call home. And we're providing $500,000 through the Community Transportation Grant Program to connect surrounding communities with Via Rail and Belleville Transit. And today, I'm thrilled to announce that we are making another landmark investment in the future of Prince Edward County. I've been investing in hospitals right across this province, from one end of Ontario to the other. Today, these investments are at your doorsteps. Our government is proud to announce an $8.7 million planning grant for the new Prince Edward County Memorial Hospital. Absolutely. It's exciting. Once built, the new state-of-the-art hospital in Picton will include a new, larger 24/7 emergency room, state-of-the-art operating room for surgeries, and increased access to diagnostic services like MRIs and dialysis. It will have all the latest technologies as well as 18 inpatient beds. On top of this, the parking situation is going to get a whole lot better. There will be more parking spaces to provide better access for patients, their families, and those with mobility issues. The construction of this project will also create jobs, help local suppliers and businesses, and contribute to the long-term recovery of this area. Today's investment is another step forward in our government's plan to end hallway healthcare. This is just absolute fantastic news for Picton and all of Prince Edward County. And on top of these investments, we continue to invest in frontline care. We've provided Quinte Health with $1.4 million through the Health Infrastructure Renewal Fund to make much-needed renovations and repairs to existing facilities. Our government also continues to support Quinte Health 4 COVID-19 assessment centers, helping to track, trace, and isolate this virus. I also want to take this opportunity to thank all of our healthcare heroes at Quinte Health. And Mary Claire, CEO, it starts at the top. And you've shown great leadership, and thank you so much. I want to thank our doctors, nurses, PSWs, pharmacists, and everyone who's been helping to prevent and stop the spread of COVID-19. Your dedication, your determination, and compassion are inspiring. Friends, healthcare is our top priority. We're making unprecedented investments this year, including an additional $7.7 billion to support frontline healthcare in response to COVID-19, as well as the most comprehensive COVID-19 fall preparedness plan in the country, which includes an investment of $2.8 billion to expand testing, clear the surgery backlog, protect their long-term care residents, and recruit more PSW nurses. We will continue to make strategic investments to shore up the front lines of our healthcare system and ensure patients continue to receive the quality care they need and deserve. Thank you, and God bless the people of Ontario. I'll turn it over to Minister Elliott.
Thank you, Premier, and good afternoon, everyone. It's always a pleasure for me to come back to the county, and especially on such a beautiful day as this. But let me start by thanking the staff and leadership at Quinte Healthcare for your incredible and ongoing efforts in response to the COVID-19 pandemic. These are unprecedented times for all of us. But when this virus swept across the world, our doctors, nurses, and healthcare workers showed us the depth of their compassion and their commitment to protecting us and keeping us all safe. I do want to extend my deepest appreciation to all the staff, physicians, nurses, and volunteers at Quinte Healthcare for your tireless efforts to deliver exceptional care to your patients. Thank you from everyone in government. Thank you. I also want to take this opportunity to congratulate Mary Claire Egberts on her upcoming retirement. We thank you for the leadership that you've demonstrated not only during your time as President and CEO of Quinte Healthcare, but throughout your nearly 30-year career in the health services sector. This is a well-earned retirement, and we wish you all of the best in the future, enjoying your family and your new grandchildren too, soon to be. Now, our government is moving quickly to address the challenges facing our healthcare system, both as a result of COVID-19 and pre-existing capacity challenges. Part of our plan to end hallway healthcare includes looking at the needs of rural hospitals. like the Prince Edward County Memorial Hospital, that are essential to their communities. Rural hospitals have always played a critical role to ensure all Ontarians, regardless of where they live, have equitable access to high-quality care, both now and into the future. The new Prince Edward County Memorial Hospital is going to help ensure this continues to be true. Once complete, people and families living in Prince Edward County will have access to a state-of-the-art facility and services that will meet the growing needs of the community. Patients will benefit from 6 additional inpatient beds, bringing the total to 18 beds, with the ability to expand if the need arises. These beds will be in private patient rooms that will enhance infection prevention and control measures. There will be a larger 24/7 emergency room and modern surgical suites with the best technology available. And the new hospital will also offer dialysis treatment, diagnostic imaging, and outpatient services, including access to minor surgical procedures such as endoscopies. So I want to congratulate all of the partners who have come together in support of this project, including the Hospital Foundation and the Auxiliary. This is an incredible project that is going to benefit the entire community, and I know that many of you have been working on this for a number of years. I also want to acknowledge my friend and colleague and your MPP, Minister Todd Smith, who has passionately advocated for this project in your community. Investing in hospital projects like this is essential to ensure that all regions across the province have the capacity to deliver the care Ontarians need and deserve, and these unprecedented times only reinforce this. Together, and it is a team, all of us together, we will build a patient-centered healthcare connected system and end hallway healthcare in Ontario. And now I would like to pass things over to Minister Todd Smith, your MPP, to share a few words. Thank you.
Thank you very much, Minister Elliott, and thank you, Premier, for being with us today in Prince Edward County. It's the most beautiful fall day of the year, and your announcement today makes it especially brilliant here in Prince Edward County. For over a century, the people of Prince Edward County have been dedicated to providing exceptional hospital care for this rural community. This hasn't always been an easy process, as I look at Leo Finnegan, who's been advocating for this hospital for many, many years, who's sitting with us today. I've been the member of provincial parliament for over 9 years now, and in that time I've seen multiple town halls, letter writing campaigns, community fundraising, and collaborative planning led by Quinte Healthcare to ensure that we have a state-of-the-art hospital to replace this 61-year-old facility behind us. The inclusion of a 24/7 emergency department, a major increase in funded inpatient beds, and a modern surgical suite underscores the fact that our government has listened to this community's desire to keep a full range of services right here in Prince Edward County. I know this is of crucial importance to my friend the Mayor, Steve Ferguson, who's with us today, and the Council here in Prince Edward County, as they plan services in a community with a median age 13 years higher than the provincial average. This community also sees its summer population skyrocket. I know many of you watching this were visitors here this summer, seeking the beautiful sandy beaches and award-winning wineries that we have, and the renowned artisans that now call Prince Edward County home. A vibrant hospital is an important economic driver, but more importantly, it offers peace of mind that residents will get the best and most appropriate care close to home. It also keeps our most acute regional hospitals in Belleville and Trenton and Kingston well positioned to treat those who need more specialized care. I'm excited that this $8.7 million investment will put us on the right path to address hallway health care in this community. And with the help of the Prince Edward Family Health Team and the doctors there and other valued frontline staff, meet our healthcare needs throughout the COVID pandemic and beyond. I know this community will share our confidence and rally around Quinte Healthcare along with the Hospital Foundation to back this build. So thank you everyone for being here.
Okay, we'll go
Thanks, Minister.
go to the phone line for questions. First question, please.
Your first question comes from Brian Lilly with the Toronto Sun. Please go ahead.
Hi, Brian.
Hi, Premier. I'm wondering if you can respond to criticisms of the lockdown, the 28-day closure of restaurants and so on by Mark McEwen. He's saying that they are not working, that it is detrimental to the industry, and he's saying that you should be brave and lead Ontario back to work.
Well, thanks for the question. I have a great deal of respect for Mark McEwen. He's a great entrepreneur, one of the great restaurant owners, and unfortunately, Mark's not a medical professional. He's a business owner. I understand that. He gets it. But I have to listen to the health professionals, and we see the numbers going up, and we're concerned about that. We're over 800 cases. There's only 5 regions. We're down to only 5 regions in the entire province that don't have any cases. That's telling me it's spreading right across the province, which is concerning. But in saying that, I respect what he's saying. But again, we have to focus on the health and the safety of everyone across the province. And maybe I'll have the Minister of Health talk as well.
Well, I certainly understand Mr. McEwen's frustration. He is a great restaurateur and entrepreneur, but what we have to look at and listen to is the scientific clinical evidence, and we've been advised by our public health measures table by Dr. Williams and his team that these are measures that we need to take in order to stop the community spread of COVID-19. There are some economic points of assistance that we will be providing, but for this time period we need to make sure, because we know there is community transmission that is happening from some restaurants and bars, that we need to have this lockdown in those areas for the next 28 days. The idea is that this will flatten the curve, bring the numbers down to a more manageable level, not overwhelm our hospitals. And the evidence also says that if you take these steps now, that it prevents us from having to go into a longer period of lockdown with more economic shutdowns. So while we recognize this is very difficult for many business owners, this is the advice we've received from the medical professionals, the public health professionals, that this is something that we need to do right now.
Follow up.
The 28-day period, Quebec admitted yesterday that theirs will not end, that it will go past 28 days. Mm-hmm. I'm wondering what the plan is beyond rotating lockdowns. You know, if we stay in this 700 to 800 case window, do we just stay in this modified stage 2? Do we come out of it and then go back into it in a few weeks? Is there something that the province can look at doing other than continually shutting down specific businesses?
Well, thanks, Brian, for that. And trust me, when I say I hate shutting anything down, I hate shutting it down. Absolutely hate it. I understand what it takes to meet a payroll, take care of a business. I absolutely despise it. But I've said right from the get-go, I'm always going to listen to the health professionals, and I'm going to continue listening to them. We have to have a happy balance of the health and the economic health of people. And, you know, I always say to our health team, how do you measure depression when someone loses their business or loses everything they have? How do you measure that? It's very, very tough. How do you measure mental health? That plays a role in it. And I've made it very clear to the health table that they have to take that into consideration. I truly believe they do. I've always said, I believe Dr. Williams has been very pragmatic. Dr. Brown's been very pragmatic. The whole health team has. They take that seriously as well. As they give us the health advice, that the number one priority, we won't even have an economy if this thing just continues to spread and gets up over 1,000 cases. And I'll give you an example. Take a look what's happening in Alberta. I have a great deal of respect for Jason Kenney. Matter of fact, he's one of my closest allies, a great leader out in Alberta, a great premier. But you're seeing the numbers skyrocket. And if you do it per capita, it's probably up to close to 1,500 cases happening. So I just want to make sure we keep our hands around this and do everything we can with balancing the economy as well. It's not easy, I'll tell you. But the last thing I want to do, Brian, is close places down. I really don't want to do that, but I'll listen to the health professionals.
Next question.
Your next question comes from David Atkin with Global News.
Hi,
Please
David.
go ahead.
How you doing, David?
Hi, Premier, Minister. Thank you for taking my question. I'm calling from Ottawa, and it's been a month since the throne speech here, and you may recall that in that throne speech, the federal government made some commitments to helping improve standards in long-term care facilities. And so I guess first question for you, Premier, if you could perhaps update us on what, if any, progress has been made on establishing a work plan or getting together with the feds. I'm curious if you could let us know where we're at on that.
Yeah, thanks for that question, David. We had this conversation with the Prime Minister last week, along with the other premiers. It's an absolute priority that we're at the table. Health is the jurisdiction of all provinces. We have no problem at all sitting down with the federal government and coming up with a collaborative plan. But most of all, we need funding. We need the CHT, Canadian Health Transfers, to increase. As healthcare is increasing, we aren't seeing the funding increasing as well. And I'm talking long term. If they have a plan that they're going to support us in long-term care, two things: we need to be at the table, and secondly, they have to help fund it. It's easy to come up with a plan and say go do it, but when the funding's not there, then there's going to be an issue. So by all means, we look forward to sitting down and have a good conversation with the federal government and work things out, and they have to come to the table. As of right now, they have not come to the table for long-term funding when it comes to that issue, and plus the CHT too. We need to have that conversation. We need to see an increase. It's just not sustainable. As I was mentioning, we increased funding in healthcare $7.7 billion. That's massive, absolutely massive. But we need their support. And they've been great partners so far. We need them to continue to be great partners.
Follow up?
Terrific. Yes, thank you. Terrific. Thank you, Premier. And Premier, maybe I'm curious about your thoughts on this one, and perhaps Minister Elliott as well. And that's really just give me your sense of how you're feeling at this point about our long-term care facilities here in the province. I know you were so concerned about it in that first wave, and I'm wondering if you give us your sense, and Minister Elliott, perhaps you as well, on where you think the risks are now relative to that first wave. What, if anything else in terms of resources we need in our LTC facilities? Give us a snapshot of where things are in terms of protecting those residents.
Well, it's the number one priority to take care of the most vulnerable people in society. We've inherited a broken system, a system that's been broken for over 30 years, probably even longer than 30 years. We're putting more funding into long-term care than ever in the history of this country, in the history of this province. We're putting over $500 million in making sure that we're building new long-term care rapid builds throughout the province, and we'll have those completed within the year, along with having support again from the federal government. And I'll pass it over to Minister Elliott.
Well, protecting our residents in long-term care is an absolute priority for us. They're among the most vulnerable residents in Ontario. And what we're doing from a health perspective is making sure that long-term care homes are paired with hospitals, so that if they're having situations where they're having an outbreak, if they're having infection, protection and control issues or staffing issues, that hospitals can go in and help out, whether by assisting just with staff or in some cases with management. So we want to continue to reinforce what's happening in our long-term care homes. If they have problems with outbreaks, we're going to be there with hospital assistance and other public health assistance, because we want to make sure that those residents are absolutely protected.
Next question.
Your next question comes from Melissa Candelaria with Your TV Halton. Please go ahead.
Hi, Melissa.
Hi, thanks for taking my questions.
Thank you.
The first question I guess I wanted to ask is with regards to modified stage 2, our numbers in Halton are going up, and I just wanted to get a sense of are there any going to be decisions with regards to putting us in a modified stage 2 as well?
Well, we're going to have that discussion. It's very concerning out in Halton. I had a good conversation with the mayors out in Halton as well. We're going to have to discuss that over the weekend, and we'll have that answer on Monday. But I appreciate that. But folks in Halton, I know they're doing a great job, but it's concerning right now. I've seen the numbers go up again.
Follow up.
Okay, yep, and I guess just maybe the minister can answer this one. With regards to diverting to flu shots here, with the flu shot program, there has been some confusion in Halton as well in terms of getting access. Some are not able to get their flu shot yet, some can. Can you give us a more clear indication as to when it'll be readily available for everybody, not just the most vulnerable in Halton?
Sure, absolutely. We started when the first shipments came in around the end of September and sent the shipments to long-term care homes, to retirement homes that were participating, and homes of congregate care, because we want to make sure that these very vulnerable residents are protected, as well as people in hospitals. Since then, shipments have been sent out to pharmacies, to physicians' offices, nurse practitioners, community health centers as well. And I can tell you that we initially ordered 5.1 million doses, 700,000 more than we ordered last year. We've also recently procured, with the assistance of the federal government, another 350,000 doses. So we've already shipped out over 1 million more doses this year at this time than we had last year. And we are receiving shipments on a regular basis. We are expecting within the next week or so that we will receive another large shipment in. So there is no shortage of flu shots for people. Anyone who wants to receive one will be able to get one, but these are set schedules that were established when we initially made the order approximately a year ago, and they are coming in. There is no shortage, and there's no delay in shipments. So anyone who wants to get a flu shot will be able to get one. They may have to wait a short while, but it will be available soon.
Just to follow up with the minister, I promised one of the reporters yesterday asked me we'd get the numbers. So as the minister said, we had 5.1 million doses ordered a year ago. And how it works, folks, it goes through the federal government. They order it and ship it in. So far, we've distributed over 4.6 million. The other 400 or 500,000, I should say, are en route, and they're going to be shipped out within that volume. With 920,000 went to pharmacies. The balance went to public health areas that they'll be distributed. And the way they distribute it is based on last year's numbers. That's the only thing they have. So they'll be sending them to the doc's offices. But keep in mind, this is a global issue across the world, and everyone is vying for this. But as the minister said, we believe we have enough. We have more on order as well with the federal government, and we're keeping a sharp eye on the numbers. I've been in communication with the largest pharmacy, the CEO this morning, a Shoppers Drug Mart. He says the volumes are increasing, and I want to encourage everyone to go get a flu shot. Call ahead to make sure that your local doctor's office has it, or the local pharmacy. I will give you a commitment. I know it's small and people may think it's minor, but until every single person in this province, every single senior has a flu shot, I'm not jumping the line. I will wait until everyone has it, then I will get mine. I know it's a bad comparison, but it's almost like the haircut. I'm waiting until everyone has theirs, and then once they have it, I'll be in line as well. But that's the situation, and those are the numbers, and I'll keep you up to breast of the numbers as we move forward.
Next question.
Your next question comes from Randy Rath with CHCH. Please go ahead.
Hi, Randy.
Hi, Premier. I want to ask you about the situation in Caledonia. Yesterday, a judge made permanent a court order demanding that protesters leave a housing development. In response, they dug up the street with a backhoe, lit tires on fire, lit a telephone pole on fire, and got into a confrontation with police in which we believe rubber bullets were fired. What do you see as a path forward to resolve the situation there?
Well, I've talked to the chief there, and you know something, I'm not going to be very blunt. I'm not going to tolerate violence. It's very simple. And he told me he doesn't tolerate it. So I don't know if a few folks are going rogue, but the way you get things settled is by sitting around the table, talking about solutions. You don't go after our police. You don't start burning telephone poles. You don't start digging up roads. That's unacceptable, and we won't tolerate it. Very, very simple. You want to sit down, as I said before, you come to my office, we sit down, we come up with a solution. But again, I think the chief's working hard, but sometimes it's hard for the chief to control the whole community. But it's unfortunate. We have a couple bad apples causing problems. But you just can't go in there. These are people. Let's flip this for a little bit. These people have saved everything they've had. They go into a community. They buy a home, like all of us. Our goal is to buy a home. And all of a sudden, someone comes in and says, no, not yours anymore. It's ours. It's unacceptable. It shouldn't be and won't be tolerated. It just frustrates me. There's no government that I can remember that has supported and then the First Nations community more than our government. I love the First Nations community. We have an incredible relationship right across the province. Regional Chair Roseanne Archibald, we have a phenomenal relationship. And I'm going to continue having a great relationship. But don't let a few bad apples, turn it into a bad relationship, because I can tell you folks, 99.9% of First Nations community and the people are incredible people, and we get along extremely well, and we have the best minister this province has ever seen with Minister Greg Rickford that has lived with the First Nations community for 7 years. He understands the community better than anyone. I will always support the First Nations. I will always have your back, but take care of these bad apples. Very simple. Because I won't tolerate anyone attacking our police, attacking our communities, burning down telephone poles, digging up roads. Unacceptable, and it won't be tolerated. Simple as that.
Follow up?
When you say it won't be tolerated, what exactly do you mean?
Well, again, we will do whatever it takes to make sure we have peaceful dialogue. Not violent dialogue, peaceful dialogue and collaboration. We've done it throughout the whole province with numerous First Nations communities. Anything they need, anything Regional Chief Roseanne Archibald, and I talk to her frequently, probably twice a week through messaging back and forth, anything they've ever needed, bang. I said, get it done immediately. And we have a phenomenal relationship. So hopefully we can straighten out the bad apples. And there's only a small group. And as far as I'm concerned, it's putting a bad name out there, and it's unacceptable, and it's unfair to the phenomenal First Nations community we have in this province. And I stand behind the phenomenal First Nations community, and I'll always support them. So we got to take care of the bad apples. They're causing problems.
Okay, next question.
Your next question comes from Paula Laregio with the Canadian Press. Please go ahead.
Hi, Premier. I want to take it back to long-term care for a moment.
Yes.
In July, your own ministry released a study that had really specific recommendations on how to boost staffing in homes. There was also a clear timeline to put those recommendations in place. So why haven't you acted on your own study?
We have been acting. And even before the commission have come out with recommendations, it came out with more. We have not stopped in long-term care, making sure that we get as many PSWs as possible, as many people trained up to be PSWs to get in there and support the system, the long-term care system that's been ignored for years. We're working day in and day out. We are going to have a much better long-term care system than this province has ever seen. And I think your people have been seeing it moving forward. I'll pass it over to my Minister of Health. Thank you.
Well, as the Premier indicated, we actually have been taking steps to implement the plan, particularly on the health human resources. We are working on a plan to get more nurses, more personal support workers. We've already taken action on that. And in terms of making sure that we can support our long-term care homes with backups if they need help, if they are in outbreak, to make sure that hospital staff can go in. They are already able to move people around. Hospital staff can go in to provide direct nursing care and other assistance, infection protection and control, support and advice, and generally to help as our long-term care homes are coming out of this pandemic along with the rest of us. So that many of the steps have already been taken or are in implementation right now.
Follow-up?
So some of the testimony that's come out during the commission, some of the homes have said that they had good success, or at least better results in dealing with outbreaks when they were able to send residents into hospitals, which had initially been discouraged. My question is, what happens when the hospitals are at capacity? How will you be dealing with outbreaks in homes? Is the plan to have more field hospitals? And in that case, how do you staff those field hospitals?
Well, a number of residents of long-term care homes have been moved to hospitals in situations where the long-term care homes had 4-bed rooms. They've been now changed to be 2-bed rooms for infection prevention and control and to prevent transmission of the virus. So a number of people are now in hospitals, but we've also created a number of transitional care places within our hospital corporations, so that we've been able to move some of the residents who are now in hospital to these transitional care homes where they receive the physical rehabilitation as well as the social rehabilitation that they need. This is a more appropriate place for them to be because they don't all need to be in hospital with clinical care that they provide. And the goal in the transitional care homes is to help people become more self-sufficient if they're able. Some of them may be able to be returned to their own homes, but that others will perhaps need to stay there until there are long-term care homes for them to be moved into. But of course, that does increase the numbers of people that are in our hospitals, and we're trying to keep 10% of their capacity available in the event of a surge of COVID-19 cases. And we also want to be able to continue with the procedures and surgeries that were postponed during wave 1, because sadly we are losing people due to COVID-19, but we also don't want to lose people because they didn't have their cancer surgery or their cardiac surgery on time. That's equally as important. So we have a plan to increase capacity in our hospitals if we have to, and it's different in each community where that will be, but we have a plan that's ready to go to increase the capacity if we need to keep everything moving forward.
Okay, this will be the last question.
Your final question comes from Haley Cooper with News Talk 1010. Please go ahead.
Hi, Haley.
Thank you. Hi, Premier.
Hi.
You mentioned that on Monday you should have a decision on whether Halton Region would be moved back into a modified stage 2, but Durham Region's case numbers are also going up, so we wondered if Durham was also going to be part of this weekend's conversation and if we could expect a decision on Durham also on Monday.
Well, we're going to discuss all the different regions that we see a little escalation in the cases, and we'll be able to discuss that on Monday and give you a clear answer. But again, please just keep practicing the social distancing, hand washing, and face masking.
Follow up.
Thank you. And my follow-up is also about Caledonia. We wanted to know if you've spoken with the Prime Minister or Deputy Prime Minister Freeland or Minister Blair about what's going on there. You said the solution will be found with peaceful dialogue, but at what point does this become an unattainable situation like the rail blockade near Belleville, where push came to shove and the OPP ended up having to move in and remove these protesters?
Well, Ellie, as you know, and I keep saying it, I don't direct the police, and I have all the confidence in the world in our OPP and all police services right across this province. We have the greatest police services anywhere in the world. I have not sat down and talked to the Prime Minister, the Deputy Prime Minister. We're really hoping that we'd be able to resolve this. And I know Chief Hill, First Nations, Six Nations, you know, he's doing everything he can. He's a really, really good chief. He's really trying. And again, I do not want to paint a broad brush across the Indigenous community across Ontario, just because there's some bad actors there. It's unfortunate. He's in a tough position. Matter of fact, someone burnt his own house down. Who does that? They go burn the chief's house down when they think they're getting their own way. Unacceptable. It's not going to be tolerated. Let's sit down and discuss it. And I want to thank Chief Hill for his true leadership when it comes to that. He's doing an incredible job, along with all the other chiefs. So it's unfortunate. Do you know what people in the Indigenous community want? People in the First Nations community want? They want jobs. They want prosperity. That's what they want. They want opportunities. When we made the announcement, no matter if it's mining or logging, there's great opportunities when it comes to nickel and cobalt, when we're pushing these batteries. So, and lithium. That's what they want. They want prosperity for their kids. They want a good education for the kids. And they also want broadband. They want broadband until they're connected to the rest of the world. And we were going to give you broadband. And anything they've ever asked, I want to repeat this, anything they've ever asked, you know, I said, bang, get it done. Don't question it, just get it done. So there has to be give and take. And for a small group, a dozen or a couple dozen folks that are causing these troubles, well, again, I'm asking them for their support. I'm asking them to deal with these people.
Thank you, everyone.
Thank you so much, everyone, and have a great weekend. Stay safe. Thank you.